Patients with an anxiety disorder may or may not need treatment. While some patients take medications, others may have a more manageable condition and may not need the help of therapy or medication. There are many potential treatments available for those with severe or mild cases. We can start by discussing treatments without the need of a doctor, which can often be used as prevention as well as being used as treatment. Yoga and meditation are very common for the prevention of and coping with anxiety. Just a few minutes a day can be beneficial. Yoga, meditation, and other various relaxation exercises take relatively little time, but can give huge benefits. Regular exercise can also help with anxiety. When you exercise, the body produces endorphins, a hormone that can increase your mood and overall happiness. Regular exercise has been shown to be helpful with lowering anxiety. Even if you aren't running marathons or lifting world record weights, moving around is beneficial. Activities as simple as walking can lower anxiety. You might want to start by just getting up and walking around every hour. Walk to the break room, to the water cooler, or just around for a minute or two every hour. Try not to stay stationary for too long. The support of family and friends may also be beneficial. Talking to someone, even if it isn't a therapist, for example, a friend or a family member, can help some people. But bad relationships can be detrimental to anxiety. So make sure to surround yourself with the right people and keep beneficial relationships. Another method is changing your mindset. This can be very hard to implement since thoughts are very often out of one's control. But if successful, this method can be very effective. Thinking positively and optimistically can help to limit anxiety. One way to do this is by writing down one thing you're grateful for every day. This can help to promote happiness and limit anxiety. If you try this, try not to write something vague like friends, family, or life, because this will not help as much as writing something specific. Try to write something specific to you or to the day and week that you're writing in. You can also try to write a positive that comes from a negative. Take a negative event in your life and write a good side effect that came out of it. For example, while a death is tragic, it could come with distant relatives and old friends meeting up at the funeral. Or a tragic robbery can come with better security systems than the place that was robbed. While at home prevention and coping mechanisms can provide exceptional benefits and be highly effective, sometimes, for more severe cases, professionals are needed. Therapy and medication are both options for patients. There are different types of therapy. The more traditional type can provide benefits in the long term and takes a little longer. It is an ongoing therapy that patients would continue to do. Another type of therapy also exists, called cognitive behavioral therapy. This type of therapy works on changing a patient's mindset and thoughts. It is a more demanding therapy, but it can be highly effective. An example of this type of therapy may be a patient with an anxiety of crowds. They would be told to face their fears and would be exposed to crowds. The patient would have support and would go in small steps, but it would still be demanding for the patient. Over time, the fear would go away or become less strong, and then the patient could function as if they didn't have this anxiety. A patient with anxiety has many options for coping and treatment. Some options may work better than others for patients, and they should consider all their options with their doctor to decide what works best for them. Thanks for watching.